Welcome back to the Chemo Kitchen Podcast. This is Bob, your host, and I'm continuing my conversation with Jenni Lane. Jenni's a cancer patient at the Rogel Cancer Center at the University of Michigan. Here we deep dive into diagnoses, treatment, surgery, what it's like to go through the breast cancer journey. Thanks so much for listening, and here we go. Sure. Now, I think this is key takeaway from this podcast is that when you are going through your treatment plan and you are shown some other opportunities for you to take advantage of in alternative treatment, which I don't even want to say alternative treatment any longer, because acupuncture is covered by a lot of people's insurance now, at least a number of sessions, so that it's coming around. But when you are given that opportunity to think about what you could do to help yourself on this journey, the art therapy,
so
imagery, and in acupuncture were avenues for you that you found helpful.
So at the beginning, when I was looking at the therapies and trying to figure out what do I have time for while I'm working, what can work around my schedule and I can do after work, which at that point of the day, like I didn't have anything left for anything, but the therapy for the most part didn't sap too much out of me. Well, I will say I've been paying for acupuncture out of my pocket. And so there were the ones that were endowed, that are art therapy, the guided imagery, the music therapy. And those ones, I settled in on the art therapy. I did maybe 3-4 sessions with the guided imagery person, and that was profoundly helpful in setting up how I viewed the process I was going to go through in a way that worked for me.
Okay.
And
tell me a little bit more about that, a little deeper on that imagery.
And I will say, not everybody's a therapy lover like I am, but I would say in concert with the art therapy and in concert with the sort of my talk therapy that I was doing, the guided imagery person helped me with the meaning making, and the art therapist too, I just felt like I was starting to get in these Facebook groups and people there's the metaphor of war, battlefield. There's so many terms that are used around cancer that are violence based, honestly. And it's like you against the cancer. It's like the cancer's invaded your body and your body's betrayed you. And I felt those ways. And those metaphors have been very helpful to countless people through the years. When people say you're a warrior, I take it in the spirit it's intended, which is like, I feel strong and I feel, beating cancer does still resonate with me. Mm-hmm. At the same time, I just felt like, I don't want to feel like I'm at war with my body. I don't want to be angry at my body. I want to feel like I'm working with the chemo instead of being like, curse the chemo, right?
I hear you on that. It's such a insidious disease, and big things have to be brought against it. Like these drugs are so toxic, and they're kind of dramatic. When you read about them and what they do, there's a lot of drama around it, and the whole movement of maybe it's more maybe the last 15 years, 20 years or so, where the whole F cancer thing.
Yeah.
I just can't say that anymore. I do not tempt the fates by calling cancer names anymore.
Yeah.
I do not want to poke the bear.
Yes.
Because it is so that it'll smack you in the face again. And I know it's happened to me like 5 times, right? So but again, it's just this whole being in battle. It has when I first went through it, I was like, it was going to be a battle. I was going to take care of this. So and me and my doctors, we're going to get, this shit that makes me pee red is going to, kill this cancer stuff.
Yeah.
But I think a lot, in my experience, I have found now that it's not necessarily always a battle plan. And I've had enough oncologists now to see that people choose differently about how to think about the process.
Yeah.
And I'm glad that you bring that up, because why do you want to be in battle with your body?
Yeah. I finally hit on a metaphor that has worked for me. And it especially was important at the beginning, right? When I felt like I was facing all these uncertainties. And now that I'm over the hump, and God, knock on open, knocking on wood here. But the metaphor that worked for me after a while was this idea of prescribed burn. So, So, a prescribed burn, right, where there's like invasive species and naturalists identify that there's native plants that want to come through, but they're crowded out by the invasive species. And so they burn it all down to the ground, decimate the forest floor, or wherever, a field. And it looks like it's ash. And then what comes up is what's meant to be there. The strong native species that have this established root system that are like, they've been there maybe for millennia, and they're coming up because they're strong. And so I started to think of the chemotherapy as this indiscriminate fire that just, burned everything down, good or bad, right? Just took out my white blood cells, took out all the fighting stuff, all the good stuff, along with what needed to be rooted out, which may be floating around as some rando in my leg. I don't know.
Right.
I
hear you.
Like some runaway cancer cells that just needed to be like hit with this hard stuff. And so I would think that every time I'd get a treatment, it would just take it down to nothing. And then my innate, the guided visualization therapist said to me, well, the body's wired for homeostasis. And that just really struck me. It's like, kind of like when I went through childbirth, and at a certain point, like, I got to trust my body. My body knows what to do more than my brain.
Sure does. Right. Yeah. And your body does want to be in some kind of balance, and it will find that balance again. Yeah. And your blood cells are going to come back. Yeah. Because they do. It's proven. Yeah. It's not. Yeah. It is not some rando thing.
Yeah. Right. Right. Yeah. So just kind of trusting, like, I'm not it's been harder to trust the process, I got to say, at different points. But recognizing that as sort of a natural process that happens in the planet and, like in the ecosystems, that also is within me. And, I don't always feel strong, but I do feel like my body knows what to do. And so it's righting itself right now. And that came from the art therapy. It came from the guided imagery, came from having 3 sessions in 1 week with each of those therapies, where it just like built on each other. And then I just felt like, okay, I can settle in. And again, that's a lot for most people in terms of therapy, but really helped. Now I'm not going as hard as all into as many therapies, and because I feel like that helped me set the foundation.
Nice. Jenny, it's breast cancer comes with all these big decisions. decisions that are, ultimately so personal. And at the same time, there's this huge like societal impact of deciding whether you are going to have a mastectomy and whether you're going to have reconstructive surgery. And what I guess I really want our listeners to know, and people maybe who are going to have to make these kinds of decisions, was how hard was it to come to your decision, and how did you get there?
Yeah,
because I'm really curious too about that.
Yeah, I am too. I mean, I say that because I wish there was like a formula, and the fact that there was not, for me, was hard for weeks, months, knowing that I was going to have to decide a few things. One, I didn't have to get a double mastectomy, but I chose to.
Mm-hmm.
That's at a certain point, I was pretty certain I was going to go the other way, just get a single. I changed my mind so many times, and that uncertainty is, uncertainty is hard to sit with for a prolonged period of time. So I think that was, one of the many things that made me anxious.
Mm-hmm.
I realized I haven't mentioned too, when we were on our break, like I was thinking, I haven't even acknowledged that, I've been also relying on anti-anxiety meds, and I take an antidepressant, and, I had taken, one type of mental health med right before, not right in the years leading up to this. Interestingly, started in perimenopause, when your hormones start to change.
Oh my, yeah.
Which it makes sense. Like, I've been reading more and more about how, as women get closer to people who go through menopause, as the time leading up to it, when your hormones really start to change a lot, estrogen plummets at that point, right? That does such a number on people in so many ways, but mental health wise, anxiety wise, for many people, that's the first time that shows up in their life. And so to have a type of cancer, the type of breast cancer I have, that's hormone responsive, means that I do believe, even though there's still not enough research to show, like, oh yeah, it's likely that this has an impact on your mental health. And so my depression and anxiety really compounded, as a little side note.
Sure.
So, couple that with the uncertainty, with just regular, like, life conflict, work, whatever it is, difficulties raising, a teenager and a young adult, all that stuff just, but so the decision-making process was harder for me. I think everyone's going to have reasons why it's harder for them individually. One of the reasons for me that I think maybe made it harder in one way is that I think that some people who've really identified strongly with having breasts and feel like that is kind of, they can't imagine a life without them.
Mm-hmm.
And don't want to imagine going through the world without them. Some people know so much that they want to have reconstruction done that it's not even a question. So they'll, it's possible to get reconstruction done in the same surgical process as the mastectomy.
Right.
And I remember when I first was diagnosed, and I knew that I was going to have a mastectomy, because in that initial diagnosis, I didn't mention earlier, but they found that my cancer was multifocal, which means there's more than one tumor, and I had large tumors. So I knew that I was going to have the breast removed, and not just like a targeted area with a lumpectomy or something. So anyway, at that time though, I was like, well, and I remember being flip about it, just like, why not get a boob job, free boob job at the same time? Like,
sure.
And
Yeah.
they're in and out, is what I thought. They're going to remove them. They can just put the other stuff in the place, and then I move on. Obviously, it's more complicated than that. And in fact, it's more complicated to do the reconstruction. way longer recovery time, and just, it's a little harder on the body. And the surgeon recommended that I wait.
Okay.
But for me, making decisions about whether I keep the good breast, get rid of both breasts, do reconstruction. And then there's different ways of doing reconstruction, right? You can have an implant or implants, or you can have natural tissue, right? And so natural tissue surgery is, there's a couple different ways to do it. One is sort of your belly fat is what they move up to replace the tissue and it's not just the fat, right? They're moving muscle, and it's actually a really complex surgery with 2 to 3 weeks or 2 to 3 months recovery. And I just was like, whoa, and it's painful, right, to recover from.
Sure.
And I had always had, I had some kind of biases, I guess, that I hadn't really thought about implants. And just thought, well, no, that's not really for me. And I kind of just ruled it out because of unexamined biases that I had. So every time I found myself getting closer to a decision and thinking, okay, I'm going to do reconstruction, and I'm going to do the deep flap, which is the sort of the lower belly, the abdominal transfer of tissue. As soon as I'd kind of be like, all right, I'm leaning toward that way, another thought, another day would go by, and I would be like, nah, I think I want to stay flat.
Sure.
Or, oh, I don't want to go through that much recovery. Maybe I should consider the implants. And then I would consider it and like, yep, that's what I'm going to do. So I started to feel nervous because I was on the fence about everything.
Yes, sure. Well, I mean, of course I can't imagine what a big decision it is to just remove some body parts and say, okay, I'm okay with that. Or okay, then I'm going to have surgery for reconstruction, and I'm going to use tissue from my own body, and now they have to remove that. That's a surgery in itself. Then move it in the form of another surgery.
Yeah. And there's a lot of risk with that. There's risk of necrosis, right? Your body rejecting it once it's been moved over. So, but the thing, like getting back to sort of the idea of breasts in our culture.
Yeah.
I took a lot of courses in women's studies when I was back in the day when I was in college, and I'm a feminist, and I feel like I have, probably done a fair amount of work around gender. I actually have done a lot of work in the field of gender, and also worked with a lot of transgender youth, and thought a lot about what does gender mean to people, and how different it is from person to person. But as a cisgender person myself, I thought about, for the first time, I've never really thought about, one, what does it mean to me to identify as a woman? And how do I feel about my gender? And also, how do my breasts represent that or not?
Mm-hmm.
And I talk to different friends, and I know just from having friends with breasts for years that different friends of mine have different relationships to their breasts, right? Some of my friends who are bigger breasted have felt like they've been more hindrances, that they've caused unwanted attention, harassment, physically uncomfortable, right? Like wanted to get reductions. Everyone has sort of a feeling of like, whether they're secure with their body parts and breasts, as people who have breasts in particular have, because they're so freaking forward facing, right? Like sure. You can't.
Yeah. And in our culture of, especially from in our paternalistic culture.
Yes. Yeah. The patriarchy is no joke about breasts.
Yes. So and how it's been portrayed from the early 20th century in advertising and fashion and, how you are accepted in society, but as a person who has breasts.
Yeah.
Yeah.
And sort of this idea too, as a woman, your value a lot of the time is wrapped up in how you look.
Right.
And
sure.
so we know that, and we know that breasts are often, certainly that they're like a part of your sexuality and about being attractive as a woman. And so, I certainly did a lot of thinking about that and journaling about like, what do I feel about my breasts? I came to the conclusion that I have lucked out, and I've always had a really positive relationship with my breasts. From when I started to get them, where I was like, woo, finally, like, okay, cool. Yeah. I'm proud of these, and I can fit in, like with my peers and wear a bra, and then feeling like the size I ended up with sort of fit with the rest of the size of my body. I felt like they were useful to me in a number of ways. And like they were my pals along the way, like my gals. Yeah. They're right there. Sure. Like my gals have been with me all this time. Yeah. And, I know that I've been attractive to people because of it, as, enough people had told me, I guess, like, and also just that I felt like they fit well with my clothes, and I'd look down and I'd see them and I'd be like, I have a nice rack. Mm-hmm. And so, letting go of them, I really mourned a lot before surgery. And I think it's interesting because, with anxiety, I've heard anxiety is a future centered kind of issue, yes. Right? Like where you spend a lot of time unnecessarily, but worrying about what's going to happen in the future. And so in the month or two leading up to surgery, I spent a lot of time really thinking about not being with my breasts. Not just worrying though, but like really trying to like outthink it. And granted, like as someone who's an overthinker, external processor, a lot of me thinking I could intellectually like solve this if I just, work through it enough rather than feel through it. But I did feel. And like I kind of talked to them, and I like my somatic body work healer person has been very helpful with that stuff, where I really did feel like I like zeroed in on what is this relationship and how do I feel about them. And I realized too that I had this notion that my power as a woman had something to do with like was centered, lived in my breasts.
How interesting that. Yeah, I believe it. Yeah. I believe that this is the case for so many people with breasts.
This is part of what distinguishes me, right, from someone else. And I imagined like this sister, and I kept imagining me with like my female ancestors or my friends or whatever, just like cooking together, right? Like doing something that is sort of stereotypically associated with, women caring for the family and all kind of gathering around in the kitchen, right? And this idea that I realized that I ultimately believe that women are like, I don't want to come off wrong, but just like in my mind, somewhat inherently more powerful than men.
Yeah.
And that if I didn't have breasts and I was standing alongside this counter in my head, this dream idea of what it means to have this sisterhood alongside me while we're doing some tasks together, it felt like I wouldn't belong.
Sure. I could feel that from you. And the thing that I know that you're not alone in that kind of feeling.
Yeah.
It's certainly a powerful image that you shared that I can totally relate to in the story.
Well, what I had to do then was do some work around that to come to the understanding that my power doesn't lie in this part of me that is a physical form, right? And also, I did some work in art therapy and as well as in my body work in the somatic healing, that I imagined the power swirling in my breast and sort of the dynamic nature of that, and then that power moving into me, melting into my body, being absorbed by the rest of my body, and then living within me. So that by the time I had surgery, I felt pretty chill about like, it's within me, in my, in my, and I did my body work person does a lot of heart-centered work. And I picture my heart in that. I picture just this circulating of this power and energy that's dynamic, but that I feel now like I could be just as at home in that lineup of women alongside, along the counter or whatever, just without breasts.
Yeah. I can tell that from you, that how honest this is, that you really mean that. And that you were able to come to that place. Oh.
The other thing that my somatic bodywork person helped me get to before surgery was I was feeling activated. I was feeling pretty nervous leading up. And we just really focused, a solid hour and a half, couple days before surgery on, I can't remember how she got me there, but it was this, what I wanted to personify going into surgery and what I hoped for all of the people I came in contact with, my providers, the person at the front desk, what I wanted to, she helped me imagine an aura, basically a 6-foot field around me, and asked me what color I saw. And I saw this like glowy, peachy color that was not hurried, that was at peace, that what should stay will stay, what needs to go will go. And this sort of trust in that process, so that I just made a calendar reminder. I had to be at the hospital at 6 a.m. So 6 a.m. calendar reminder, hold on to your aura. And that from when I walked in, I just felt calm. And I was able to somehow. And I felt like everyone I encountered, the nurses I talked to before surgery, everyone, no one was rushed. And it's maybe you get out what you put in, or like, I don't know, but I just felt so peaceful in that moment. The day before was a shit show, but I'm glad that I was able to feel like the experience was what it needed to be.
Yeah. Thank you for sharing that with me personally. I mean, as your friend, that, the really intimate feelings that you had around that. And I think our listeners are really going to feel the power of that as well. People who are going through things that are similar to what you've gone through.
The trick that I'm going to do, that I think once I've decided for sure I'm not going to do reconstruction, because who knows?
You could.
I have to wait at least 6 months in order to do reconstruction after this is healed, after the mastectomy is healed. And then I can decide anytime, 1 year, 2 years, to get reconstruction. And apparently insurance still covers it at that point. So, all right. One positive thing about insurance, along with it covering healthcare, for as many problems as it is. But if I stay flat, I'm going to get some badass tattoos. I'm going to get some lovely tattoos. I was just looking at my scars last night, and they're not scars yet, but the form that the incisions take is somewhat fluid. And I could imagine, what I've been imagining is both my ability to be strong and soft through this whole process, that not fully adopting a war mentality, being able to say, I have needs and ask for them to be met. And that's a whole new thing for me.
Mhm.
And so I want tattoos that can, so I've been keeping lots of different, I have a folder in this here. I've got my Pinterest folder. I've got whatever.
I just have seen these, some pages of people who are tattoo artists who specialize
Yes.
for people who have mastectomies.
Yeah.
And just how gorgeous this canvas can be.
Yeah.
Yes.
And it does feel like another way to claim some control, some like part that represents me about it. So
it just makes sounds like it makes a lot of sense. Jenni, it's the time of the podcast where I'm going to ask you a little bit about food, because we are Chemo Kitchen. After all, we started with a cookbook. Now we've got a podcast. So let's talk about it. When we started Chemo Kitchen, it was all around taste change associated with chemotherapy. And almost everybody experiences it at some place during their treatment. So tell me, how did food agree with you or disagree with you?
It was a mixed bag.
Yeah.
First type of chemo that I took really messed with my sense of taste. And at that time I hadn't gotten Chemo Kitchen cookbook yet. And after having it, I was like, dang it, why didn't I get it right at the beginning? Just because if not for the specific recipe, for the inspiration for another kind of recipe, but also, or even realizing, oh yeah, I really like tart things right now. Mm-hmm. Or I'm recognizing that ebbed and flowed, and trying to find the things that hit for me at different times. And so that's another thing I appreciate about the cookbook. The other thing I'll just say, not that I meant for this to be an ad for the cookbook, but it also was really validating in that way of feeling alone. And like, I can't describe to people like exactly how it feels to be disgusted by almonds that I have, like, ate almonds every morning for I don't know how many years, love them. And then a friend of mine who had been through chemo, I was telling him like almonds, and he said they taste like sand. And I was like, oh my God, to have somebody else like validate that was just like, yes. But I feel like the cookbook was helpful in that way too. So things that I had loved before, water. I've always been a huge water drinker for, I don't know how many months. Like I was like, oh God, I just can't with plain water.
Oh,
have you had that?
I never had that. I've heard it. That you taste it, you taste all the bad parts of water. I don't know. What did it taste like to you?
I mean, it tastes like nothingness in a way. But that's that seems normal. I can't even convey it. It just was like, like I would be thirstier after drinking it.
Oh,
it was so weird. Yeah. So I know it's really individual.
So what was your favorite thing to eat?
Oh, favorite things to eat? I have to say, when somebody lovingly makes something for me, it just like calls to mind, like teary about it, because I get teary about gratitude. And so soups that people made for me, broths that people made that were like had magical healing powers in them, that I know take a long time to make because I've made them before. And to really pack in the richness of ways broths can be made.
When someone makes something for you, it really is that even extra healing. There's a healing power to it.
Yeah. Taking bites, whatever it was, just taking a bite, knowing and people told me, when I made this for you, I thought about you the whole time. friends of mine who pray told me that when they made something, they were praying for me, and just knowing what that means to them and the spirit of what that means to them when I'm eating it. Gosh.
Yeah. The healing power of food.
Yeah.
It's a true thing.
Yeah.
Well, that's a real positive note to close out our conversation. I am just so impressed with how you have gone through this journey and how you continue to go through this journey with a lot of grace. I want to tell you that as your friend. I see that, and I want to acknowledge that to the world. So, listeners, there is hope. You're not alone. And we see you. So until next time, take care, you guys.
Thanks, Bob.
Thanks, Jenny.
Thanks, folks.
Well, that wraps up part 2 of my conversation with Jenni Lane and her journey through breast cancer survival. Hey, thanks so much for listening. You can also find us on the web, chemokitchen.com. You'll find a great community page where you can share your story, and maybe you'll be on the next podcast. We look forward to hearing from you. You could also find great socks, hats, water bottles, things you might need while you're sitting in your chair having chemo. Thanks so much for taking a listen. We sure appreciate you. Till next time.